Welcome. Today, teachers of the Heart of Love Early Childhood Center will be engaging in discussions on the topic assessment and intervention in reference to a child that they suspect has a cognitive delay. Teachers are Amanda Nichols, Diane Tingling, Keisha Small, Tanya Stanko, Suzanne Nicholas Glasgow, and myself, Roxanne Richard Stewart. I now hand you over to Suzanne, who will deliver the introduction.
We are all aware that in the classroom, teachers will face multiple types of developmental delays in children. According to the Michigan University 2010, developmental delay is when your child does not reach their developmental milestones at a particular time. The developmental delay can happen in one or many areas. For example, cognitive delay, where a child is unable to think, process, and understand basic concepts such as problem solving. According to the National Association of the Education of Young Children, 2008, assessment is the process of observing, recording, and documenting what children do and how they do it as a basis for the variety of educational decisions that affect the child. Moreover, observation and assessment lays the foundation to detecting if an individual program or early intervention is needed to help a child reach its optimal development. Today, we will be discussing a 5-year-old boy's developmental delay. We, his teachers, observed some patterns of his development that are not consistent with his age. He seems to be having problems processing information or a cognitive delay. Therefore, we engaged in systematic observations to determine if there is indeed a delay in his development and what steps can be taken to assist him. Let me go a little more in depth with identifying cognitive delay. Cognitive delay, also referred to as intellectual disability, describes the condition of a child whose intellectual functioning level and adaptive skills are significantly below the average for a child of his chronological age, according to Siskin Children's Institute. Signs of cognitive delay can be recognized as early as 2 years of age. Some of the most regular signs of intellectual disability in a child are delays in reaching early childhood developmental milestones, inability to connect actions with consequences, disability with problem solving or logical thinking, difficulty retaining information and learning simple routines, difficulty understanding consequences of actions, and lack of age-appropriate self-help and self-care skills, all according to BERT 2006. Amanda, could you elaborate on the long-term challenges of cognitive delay, please?
Long-term effects of not addressing cognitive delay in a child. Some of the effects of not addressing a child's cognitive delay, according to Wallace et al. 2015, are delayed speech. The child may face grave difficulties in learning basic phonic sounds, which may lead to a delay in the child's ability to communicate effectively with others due to their limited vocabulary. The child may have issues pronouncing words and forming sentences, which could cause further problems for them as they grow older. They may face an inability to retain information. Because the child may experience hurdles with speech, they may find it difficult to learn things such as counting and the alphabet. They may also have a lack of self-confidence. The child may feel insecure about themselves, since they may notice that they have different capabilities from their peers. This may hurt their self-esteem. They may face hurdles when completing tasks, and they may not be as efficient in completing simple tasks due to their lack of understanding and logic. They may be unable to follow instructions, and they may also show low academic performance due to their limitations in understanding and following instructions. Intervention is necessary, since this could be an attempt to help the child to lead as close to a normal life as possible. Some forms of intervention, according to Nelson, Nygren, Walker, and Pushuna 2006, are speech therapy, which is simplifying the process of learning language to ensure the child understands and grasps pronunciation and phonic sounds. Positive reinforcement, which is encouraging the child to complete simple tasks and cheering on their progress. This helps to boost their self esteem. Another form is visual aids, employing the use of charts and picture signs to help the child remember order and sequence. Another form is developing the child's attention span by providing them with puzzles and painting activities. This helps with their concentration and memory skills.
We as early years educators must be concerned about developmental delay. The cause for developmental delays can be difficult to detect, and a variety of things can contribute to it. For example, birth defects. Teachers must be concerned if a child is behind in their developmental milestone. Typically, professionals can recommend intervention for a child with cognitive delay as early as it is detected, and addressing delay from an early stage will help to take control and not allow the delay to progress. And that is why we, as early years practitioners, have to take the initiative for taking the decision and conducting systematic observation to identify a child with cognitive delay. For example, David, that we have observed that he has difficulty recalling familiar objects. He speaks in one and two sentences, and he does not seem to remember part of a story. And this is indeed a cause for concern, and teachers must find ways to help support that child's learning development. And the most effective way of doing this is by using different observation method and document the child. Therefore, we as early years practitioners must use observation tools to document a child's learning and learning. But another reason for using observational tools is to spark learning and development. Penn State 2018. Thus, different types of observational tools can be used. For example, a checklist, anecdotal records, time sampling can use to act for assessment and documentation of children learning and development in order to determine if they have developmental delays. Roxanne, can you now give us some justification on the different observational tools?
Thank you, Diane. Now, systematic assessment is a form of observational assessment with attention being directed to a child, a particular pattern of behavior, a situation or a problem, or progress towards an identified goal. And this is according to McPhee and Ligon 2011. The observational tools used to assess David's learning were anecdotals, time sampling, and checklists. Anecdotals are brief records written objectively and focuses on a specific outcome. And it has been categorized by Benzic since 1993 as informal observation that teachers make for future reference and as an aid in understanding some aspect of the child's personality or behavior. Further, Head Start 2018 states that anecdotal records provide neutralistic, detailed, and meaningful information about children's individual development in all domains. And according to complexneeds.org, Module 2.4, notes from anecdotal assessments are detailed, dated, and linked to a particular area of learning or a priority target in the student's individual educational plan. That's the IEP. From the first series of anecdotal observation on David, we realized that he seemed to have difficulties communicating his ideas to others and was very reserved in his interaction with his peers. Hence, we decided to employ the use of time sampling observation to record his behavior during different situations at different intervals of the day. According to Totten Lang 2012, time samples are often used to take specific note of a child's behavior in order to determine the next course of action in that specific child's learning environment. When teachers notice a behavior happening within the classroom, frequency counts and duration records can be kept to determine the severity of that behavior and to make adjustments in the environment to offer that child opportunities to improve in that particular area of development. Now, Thornton Lang 2012 also suggests that checklists are quick ways for teachers to determine if a child is meeting developmental goals set. Therefore, using the information from the anecdotal and time sampling records, we were able to develop checklists that charts David's development in the attainment of specific behavior and key developmental milestones. In order for observation and assessment tools to be comprehensive, observation should be made during a variety of situations. The use of combined observational tools assists teachers to understand a child's interests, skills, ability, and needs. And it provides teachers with comprehensive information to effectively plan for the needs of the individual child. Now, Tanya will explain how often these observational tools were used. Tanya?
My name is Tanya Stanko, and I will be discussing with you all how often the observational tools were used during our observations. We conducted a series of observations using anecdotal, time sampling, and checklists over a period of 3 months. At the end of each observation, strategies to improve the child's weak skills were undertaken. Anecdotal records were used during the first week every day during different activities. The findings were reviewed and strategies were implemented to improve opportunities for the child's development. Following this, anecdotal records were conducted once a week to record improvements. Time sampling was conducted each day for the second week of observation and continued once a week to record changes in behavior after intervention. Checklists were used for a total of 13 times. The first checklist observation was conducted on the first day to assess if the child's cognitive development was consistent in relation to his age, developmental milestone. These checklists entail specific criteria from different areas of development. For example, cognitive, language, physical, and social. And on the first day of observations, following which they were used once every 2 weeks to compare results after intervention. Keisha, can you please enlighten us on the strategies needed to support cognitive delay?
Let's discuss and talk about some strategies needed to support the development of the delay. Routines. These can be daily routines, lunch, circle time, center time, break, etc. Having students perform daily routines can help them to keep track of activities and also support their thinking and memory skills. Students with this type of delay need to have regular activities to aid with development and also consistency. Developmentally appropriate materials. These can be toys, charts, books, etc. As an earlier educator, we understand the importance of having the right material for a specific age range. Special students who have developmental delays need to be carefully watched to ensure they do not hurt themselves or other students while playing with specific toys or games. Acknowledging achievements. Students need to feel acknowledged for their achievements for trying and not giving up. Students should be acknowledged for their hard work so they can continue to feel motivated and work harder and keep trying. Providing a supportive learning environment. Students should feel loved and shouldn't be scared or frightened to go to school or the classroom environment. The classroom environment should be that of a learning, exciting, comfortable, and enjoyable environment that makes the student feel safe and comfortable to be in. Working with parents and guardians. This strategy is very important, especially for students with delays. Working with parents and guardians is a must for all schools and educators to ensure students' success and development. Working closely with parents and guardians can ensure that the child is getting the necessary help needed for their development. Hands-on material and experience. Learning should be a mixture of hands-on experience and regular work. Students should be encouraged to engage on hands-on experience and materials to provide and promote development of fine motor skills, large motor skills, thinking and analyzing skills. And finally, speaking in short sentences. Educators should be speaking in short and simple sentences which are easy for students to follow. Students should be given time to fully grasp information before moving on to another topic, especially for students with cognitive delay. Educators should ensure the student fully understands the information and concepts before moving on or building from past concepts. In some situations, educators use hands-on experience and activity to aid with development. These are just some of the strategies needed for the development of the young child.
In conclusion, after closely monitoring and observing children, teachers can use various strategies in their classrooms to support young children's development. They can use strategies communicating with parents and guardians, having a supportive learning environment, praise the child for each accomplishment, and use hands-on age-appropriate materials in their classrooms. One of the most common developmental delays is cognitive delay, also referred to as intellectual disability. Cognitive delay affects a child's awareness, intellectual functioning, and can lead to learning difficulties. Through early intervention, parents and teachers can work hand in hand and using different strategies to aid the child's development. Some of the strategies include completing and updating developmental checklists, undergoing observations and assessments, providing a supportive and stimulating learning environment, providing multiple opportunities, and allowing children to complete and master tasks on their own. Having a child with a cognitive delay can be challenging for parents and teachers. However, early intervention is imperative. It is the key to helping children live a normal life. Some of the most common signs are difficulty remembering things, slow to master life skills, talking late, and challenges with logical thinking. These signs may become long-term challenges if not detected at an early age. This concludes our video presentation. We hope you all learned a lot, and we all thank you so much for your time.